Morning. A very special guest today, practicing for over 35 years, Senior Director, OBS and Gynae, Dr. Meenakshi Ahuja from Fortis La Femme joins us today. Thank you, Dr. Meenakshi, for joining us today.
Thank you so much for having me.
So, Dr. Meenakshi Ahuja, please tell us a little bit, what inspired you to become a gynecologist?
So, if I say about why I became a doctor in the first place, I come from a family of doctors. Both my parents were doctors, my aunts, uncles, everyone. So it was like a no-brainer. I used to look up to all of them, and I knew that I wanted to be a doctor too. As far as a gynecologist is concerned, I always wanted to do surgery. But my father felt that, in that time, I'm talking about, say, about 1988, 89, he said, as a female surgeon, it's going to be a little bigger struggle. And probably my personality of being and spreading happiness and having happiness around me. He said, as a gynecologist, you have your passion of working with women, doing surgery, doing medicine, and being surrounded by happiness. So yes, so here I am.
Really nice. I think you're helping a lot of women out there, which is a great deed. So, Dr. Meenakshi, tell us, what age is really the age to sort of start seeing a gynecologist? I think there's a lot of myths, that you need to come as soon as you start your periods, or maybe, anything that goes around in social media comes around, and, then we start believing it because it's a world of social media. So, what age is exactly the right age to actually start seeing a gynecologist?
So I think, you have to understand that the gynecologist should become like your best friend for your life. So it's a support system for you. And we actually end up being quite like women's GPs also. Because it's not only when they have gynecological illnesses, but even for their general well-being that they need to come and see us. So actually there are a lot of mums who are a little hesitant to talk to their girls about their periods. So they would come even before the girls start their periods that, maybe they can have that conversation with the gynecologist. Also, then there are a lot of myths about this is right, this is wrong, when should the period start? Things like that, that are they too heavy or is there too much of a gap? So the girls start seeing us then. Also, of course, for the HPV vaccination. The vaccination is meant for girls over 9 years of age. So usually the pediatrician would be giving them the vaccine in these times. But most girls who missed their vaccination while they were 12, 13, 14, they start coming to us for their vaccination. Then, of course, these hormonal issues like acne, weight gain, facial hair, irregular cycles, all signs of PCOS or hormonal turmoil, so as to say, as the girls are in their adolescence. I think that's a time when they come and see us. Probably then by the time they're 18, 19, they may have curiosities. And somehow I feel that, girls should be aware. Whatever path they take, it's their path. But to be aware about what sexual practices need to be, what is sexual hygiene, what are the contraceptives one needs to use. Maybe your gynecologist is the one who can give you much better advice than just, looking on the internet, chat GPT or social media.
Right. Absolutely. I think you're absolutely right. I think it's a lot of taboo around talking about your sexual health or your sexual practices with anybody. So I think that becomes a little difficult.
And then, there's that much confusion and myths and, everyone will give their opinion. So probably a sort of certified opinion and a guidance on what works best for you, because one size doesn't fit all. Right. Everyone has different needs, different inhibitions, different taboos, different bodies. So I think probably seeing your gynecologist so that you can have a tailor-made solution for you is a good idea.
Great. Thank you so much, Dr. Meenakshi. Dr. Meenakshi, tell me, what about these HPC vaccinations that you just spoke about? How important are they in the long term for women?
So the HPV vaccination or the human papilloma virus vaccine not only protects against cervical cancer, it also protects against other genitourinary as well as oropharyngeal cancers. Also, I must make a point here that even the boys need to get vaccinated now, because even penile cancers and oropharyngeal cancers are prevented with the vaccine. It's almost, I would say, at least a WHO recommended vaccine. It's there. It's given in over 160 countries out of whatever 200 some we have. And it's in fact part of the health policy in most countries, including frankly in India, because this last year our finance minister had also said that we'll start giving the vaccine to girls who are in school in class 6.
Right.
So it's a vaccine every girl and every woman must take. The guideline is that it can be given any time between 9 and 45 years. And I would take this opportunity to just clarify that every woman needs the vaccine, whether you are sexually active or still not sexually active, whether you started your periods or not started your periods, whether you're 26 or over, whether you've had children or not, whether you're getting your pap smear done or not, irrespective, all these things are irrelevant. Every woman needs a vaccine, and it's one of the most robust vaccines and most protective.
Right. I think a lot of information. I think thank you so much. So tell me, like, but these rural areas where, already mental health is a taboo, health, there's not so much focus on your health, or you're definitely, they're not so comfortable talking about their sexual practices. How difficult is it to explain to them that a mammography or a pap smear is an important test? And, what do you recommend? How should we spread this awareness so that they also know that this is, something that they need to get done?
So, see, there is a constraint more of finances. Thankfully, there are a lot of foundations, there are a lot of NGOs, there are a lot of government hospitals where they can avail of the facility.
Right.
But let me tell you that the problem is that even in the urban sector, a very simple thing, have you ever got your mammogram done?
No.
So you may have the financial capability, you may have the information, and even then, regular checkup with your gynecologist. People will not come for their pap smear, they will not come for their mammogram. I understand there's a fear somewhere that, you might pick up something which is wrong. The good thing is that these are screening protocols. They will pick up something even before it occurs.
Right.
And so, actually, for your longevity, your health, and not only your present, but even for your future, they are very, very important. And I would say that definitely you're seeing your gynecologist for your childbirth, for sure. You don't have an option in the cities also. But probably, or definitely once you turn 40, you must get your annual health check with your gynecologist.
I think, well said. I'm very scared to get my mammogram, and, I do get my pap smear, but of course, I'm a part of that select urban women who have not yet.
Yeah.
So tell me, what about these birth control pills? Is there a side effect to the to the fertility of the women where it comes to birth control pills? Because I think now the advertisements and everything that you see, they just say, "Acha, ye kha lo," and you're good to go. So what is your, what would you advise the women of today for these birth control pills that they have?
So here again, two things I would like to make clear. There's something known as an emergency contraceptive pill, or the brand name I-pill, which most people know. That is a different thing. And the birth control pills, which are for regular use, is a different thing. So as far as the I-pill is concerned, it's called an emergency contraceptive. It's not something that you should take every time you have sex, or you have every month, or thrice a month, or even once a year, like that. It's an emergency. I expect that one gets into an emergency once or twice in your life.
Correct.
Also remember that it's not fail-proof. That's number one. And it has a lot of tendency to bungle up your cycle for the next 2-3 months, and may even cause continuation of pregnancies, or at worst ectopic pregnancies, which are tubal pregnancies, which are actually life-threatening. As far as the other birth control pills, the standard birth control, regular 21 or 24 or 28-day cycles are concerned, those pills are extremely safe. They don't have side effects. They, there's a risk that there's blood clotting or something, that is also less in Asians. And girls are using it even for PCOS at a young age. They can be taken for years. All over the world, birth control pills are prescribed to girls for years together. So definitely, rather than getting repeated abortions done, or, landing up in problems because of irregular cycles and otherwise, the birth control pill is extremely safe, extremely effective, and probably a great contraception. One point I would like to make here is that the birth control pills don't, prevent STIs.
Okay.
So if you're not in a single partner relationship or a committed relationship, you're both not mutually exclusive to each other, then definitely please use other barrier contraception like male or female condoms, but the pill is extremely effectively safe to prevent an unwanted pregnancy.
Great. Also, one more thing. Let's touch this topic for PCOS. So we live in a world of social media. What we see is what we believe. Now, we also believe that if somebody has thyroid, somebody's got PCOS, and it's not easy to conceive. And of course, everybody believes it because it's been a part. Like we've been hearing it on social media now for the last couple of years, and then everybody says, it gets difficult. So does your lifestyle somewhere, come into, I would say, like, just does it become better with a better lifestyle, or is it something that, it doesn't matter? I mean, these are basic issues that everybody has because everybody has PCOS, everybody has thyroid, everybody has these issues. So is it like an okay sort of a situation where we say, okay, it's okay, everybody has it, it's fine. But is there a way to, get out of it? Is there something that one could follow the women could follow to make it better? So that's what I wanted to ask you.
So, see, fertility as it is tends to lag behind after 30 years. Most girls are having children after 30. So that's one factor, age-related, which you can't reverse.
Right.
Right? There are other issues which will come in the way of fertility, which would be a hormonal imbalance, which could be a prolactin issue, could be a thyroid issue, could be a PCOS issue. Definitely lifestyle-related, stress-related, and can be kept under control. But at the same time, if you have a good lifestyle and you have a thyroid issue or a prolactin issue, taking medicine and correcting it is not a bad thing. I mean, sometimes I see girls who are really fit and really healthy, and they say, "Mujhe kaise thyroid ho gaya?" That doesn't even make sense. It's a hormonal issue. It can happen to anyone. And you need to keep it corrected. That's the point. So that's one. Then there are things like endometriosis. Your egg reserves are going lower as age is advancing. So actually, it's very important that when you decide, with PCOS aside, because there are cosmetic issues also for which girls will come to us.
Right.
But girls may not think, say at 24, 25, that fertility is on top of their mind. But please remember that if you're going to have children after 30, and there are other factors which are also coming in. So that is your choice. It's okay. You want to have children over 30, there are other options. There are ways to go about it. But keep your hormones in balance then. Because let it not be an added factor. And definitely keeping a healthy lifestyle, cutting down your carbs, having high protein diet, regularly exercising, seeing that your cycle is in order, because that's one good sign. If your periods are coming regularly, your weight is remaining constant, your skin is clear, then definitely you don't need to worry about PCOS. But if there is an issue, please solve it so that it doesn't come in the way of your fertility later.
Right, absolutely. I think well said. So Dr. Meenakshi, tell us, set aside PCOS and set aside all these issues that women have. Tell me a little bit about, since you've been practicing for so many years, and of course you must have come around with so many patients, and I think there'll be some interesting story that you'd like to tell us about some patient, some woman that has come across and left some mark with you and said, okay, yeah, this is one story I'll remember for my life.
Now that is really a toughie because I think every woman is unique and everyone has their own story, and every instance stays with us because for us also it's a learning experience. And frankly, I always tell a patient when she comes to me that, she'll say, no, but this is what happened with my friend, and, she took this and this got okay. I said, you are not all Maruti cars. You are not made in the same factory. Everyone is different. And the way you respond and how we need to work with you is completely unique. You're one specimen on this earth. You are unique. So, for us also, that vibe continues and you feel enthusiastic about your work. Like, I don't think touch wood, I've been, doing this for 35 years and hopefully have more years ahead. It keeps me going because the buzz that it's something new. I don't think I'm going to get a burnout because of this, or it doesn't become boring or tedious because every patient is different.
Yeah.
And Yeah, like people have very fixed ideas. Like I remember that there was someone who told me that during delivery, before that only, doc, I'm very clear. I want absolutely normal and I don't want any interference or anything like that. And, like I said, yeah, okay, let's see. And her mother's also explaining to her that, no, if there's need, you can take epidural and all. No, I've read this book and that book and that book. And the first pain she got, the whole hospital could hear that scream. And she said, please give me epidural. I can't live without it. So what I mean is, I would feel that, with whatever journey you're going in, discuss with your doctor. Of course, discuss your apprehensions, discuss your anxieties, but find your path. And don't be fixated on something just because your friend did this. Because everyone is different. And it doesn't make you better or worse. There are people who will conceive naturally. There are people who will have a pregnancy when they're not even looking for one. They may not even continue that pregnancy.
Right.
And at the other side, there are people who are struggling for fertility. My one OPD will be that, struggling with fertility. There are people who are going for IVF. They're looking for surrogacy. There are girls who are freezing their eggs, and there are girls with unwanted pregnancies. So there is a whole gamut. There's a whole spectrum. So whatever you are, bless yourself for whatever you are. Be thankful for it. Practice gratitude. And work the path, which is to say, and at least understand your options so that you don't get stuck in a corner.
Absolutely. I think very well said. Last question, which is actually something that I'm asking you. Tell me, what do you would tell women who want to have babies after 40?
Okay. So, it's not impossible. Number two, I think that if you want children after 40, and you're 40, you must start as soon as possible. That's for sure. You don't have time to waste. Because anything your gynecologist can do, she can't reverse the clock. I have patients who've conceived naturally and had very comfortable pregnancies, because nowadays at 40, girls are very fit and healthy. And they understand that during pregnancy, you don't need that extra weight gain. They keep their blood pressure and sugar in control. Yeah. So that's number one. The only the problem which occurs is that your eggs start aging after 35. So it's, the chances of infertility, the chances of miscarriages, and the chances of abnormal pregnancies do increase as age advances. So you must hurry about it, start your vitamins, antioxidants, so that we can have the best eggs possible. Secondly, if you're 30 and you've decided that you want kids after 40, please freeze your eggs. That's for sure. Like I said, you must understand your options at the right time. But if you're 40, your cycles are regular, and as long as you understand that at 30, say a simple thing like Down syndrome, one of the commonest problems that one hears about and then one is worried. The chance of Down syndrome at 30 are about 1 in 500. By 35, they become 1 in 250, so they sort of double. By 40, they're 1 in 50, so it becomes 5 times. And by the time you're 42, it's 1 in 20. So it's an exponential rise. But when you go understanding that it's 1 in 20, that means 19 out of 20 or 95%, it won't happen.
Absolutely.
So, it's a more comforting thing that it's possible that we have a healthy baby also.
Yes.
So, if you're willing to take that risk, that, if I have a miscarriage, then I look for other options. But I understand that if the pregnancy is not healthy, it will not continue. Definitely conceiving on your own after having supplements, having folic acid, having antioxidants, your husband's sperm count also being fine and he also being on the same routine and a good lifestyle, you can definitely try. Safest way to conceive after 40? Yes. There are a lot of people who don't want to go this path. Like I said, that's what I said, that everyone has a different path.
Absolutely.
They may choose to get IVF done directly with a PGD. A PGD is pre-implantation genetic diagnosis. So they'll pick up the best eggs, they'll pick up the best sperms, they'll pick up the best embryos and test them prior to putting it in your uterus, that at least the chromosomes are fine. And then you continue with that pregnancy. And honestly speaking, IVF today, the facilities which are available, the comfort which is there, it's definitely a viable option. So as long as you just make up your mind and start working towards it,
then nothing is impossible.
Yes, absolutely.
Great. I think a great conversation with Dr. Meenakshi Ahuja. A lot of questions that I've tried to answer, but there'll be a lot of questions that you may still have and you're still looking for answers. You can visit her. She sits at Fortis La Femme, and I'm sure Dr. Meenakshi will be very happy. Thank you so much, Dr. Meenakshi, for
Thank you, and
joining
I'm
us
sure
today.
we can
and
have a session again also. If there are a lot of
absolutely, yeah,
questions.
we will do a part 2 as well. We will come back soon. Thank you so much.
Thank you so
Thank
much
you,
for
Dr.
having me.